I'm Dr. Linda Tintle, as most of you know, and I have been involved in Shar-Pei health issues since I got involved with Shar-Pei in 1981. And so I know some of you from going way back. It's been a lot longer a journey than I had anticipated. I believe in 1992 I told you in a year or two, okay? I never thought it would take this long. And we just put down a stake in the ground. We've got a huge milestone here, but there's a lot more work to do, and I'll talk about some of that today. But this is the breakthrough for us, the breakthrough that's going to make a big difference for the entire breed. So I'm going to start out by talking about Shar-Pei autoinflammatory disease. And this encompasses a number of different things. And one of the things, we used to talk about simply Shar-Pei fever. And it's a lot more than Shar-Pei fever. Shar-Pei fever is just the big red flag these dogs wave to say we've got some issues going on here. Okay, it's the most obvious sign we see. But it's just one face of Shar-Pei autoinflammatory disease. Hyaluronan is the key element here, and we're going to talk a lot about that today. I'm not going to make you repeat it after me, so you can all speak it without tripping over your tongues. But hyaluronan is a substance that's ubiquitous in all of us, in our dogs, etc. It's one of the most primitive barrier molecules in our bodies. We think of it, when you sometimes see it, as an amorphous goo, a jelly-like substance. But it's really much more intricate and involved than that. It forms cables and networks. It covers all our cells. It lines our blood vessels. It's involved in the perineuronal nets in our brain. It's what makes up the goo inside an eyeball. It's your joint fluid. This stuff is everywhere. And that's one reason why, because they have a problem with it, that we see so many different kinds of problems. But hyaluronan is what defines our dogs. Our Shar-Pei have a mutation, a unique breed-specific mutation that makes them a Shar-Pei. They overexpress hyaluronan. They make too much of it. And this is what gives them their classic appearance. This is a traditional Shar-Pei here, direct from China, one I brought. Many of you saw her. This is Spitster, who was Spitty, Spirit, whatever you want to call her, that was here in costume and was involved in the obedience the other day. Okay, she's going to be 13 in this February, I think. She is a classic traditional dog. She does not have the Western-style mutations. These three all do, and this is her son, and that he ended up getting a Western-style mutation, which those of you that have been in the breed a very long time, you know, even if you had one dog that was super healthy and lived long, you then bred it to what I used to call the stud of the month club. And those dogs often died very young of amyloidosis and had fevers and all. So most breeders who got actively into the show world, where you're looking for type, very quickly got into this whole, you know, hyaluronan-associated health problems. And up until now, as breeders, and we're going to have a dialogue more about this, there wasn't a whole lot you could do except try to breed the healthiest dogs you could. But it was just pure guesswork. And we're going to try to change that today. Hyaluronan, though, is a really simple molecule. It's a disaccharide. It's a sugar. And it's formed by the combination of N-acetylglucosamine. Most of you are familiar with glucosamine. And it's made by glucuronidation, which is a method of combining a sugar in the liver, and also it does it in other tissues in the body. But it keeps making this molecule. It's just these two. It's glucuronic acid and N-acetylglucosamine formed into a chain. That's all it is, those two things, glucosamine and a sugar, okay? That process of glucuronidation is really important, and I do believe it also impacts some of the problems we have with our Shar-Pei, because glucuronidation is also how the liver metabolizes a lot of drugs and toxins and other things. And because they're so busy using glucuronidation to make hyaluronan, I think we sometimes have troubles with some of the drugs. Not every Shar-Pei, not every time, but I think this pathway of glucuronidation is one reason we've seen some trouble with Shar-Pei and Rimadyl. okay, because Rimadyl is pretty much metabolized almost exclusively by glucuronidation in the liver. Some of the others are kind of half and half, so they still potentially could have a problem, but less so, okay? The other thing is that glucuronidation, this pathway, is also involved in the production of vitamin C in dogs. And I think this is one reason why the veterinarians are taught dogs make vitamin C. They don't need vitamin C. For decades, I've been hearing from breeders that their dogs do better on vitamin C. And I truly believe that this pathway is interfering with how these dogs, or some dogs, are making vitamin C. And that's why currently I am recommending that you do supplement most Shar-Pei with 250 milligrams of vitamin C once or twice a day. So this little cartoon here is kind of everything we're going to be talking about in one slide, but I'm going to come back to a lot of these key points. When you look at this, this is a cartoon. This is not exactly what it looks like in the body, okay? What we have is on chromosome 13, there are some regulatory elements on chromosome 13. They're kind of the on and off switch for hyaluronan synthase 2, which is the enzyme that makes that hyaluronan. And these off and on switches, okay, are found, there's a CNV 14.3 and a CNV 16.1. And I'm going to be referring to what was in the first paper called the meat mouth mutation, which is the 16.1. It's the one we're going to be pretty much talking about exclusively today, because we found that the traditional 14.3 had no association with Shar-Pei autoinflammatory disease. So it's the 16.1 that we're all worried about. A regular dog or a traditional dog with two of these regulatory elements, that's what they're supposed to have, has to make hyaluronan of a certain amount. Every time, think of it as a factory. Every time that the body needs hyaluronan for all those things I was just talking about, it sends a message to the factory that I need a unit of hyaluronan, okay? The problem is that the meat mouth mutation, the 16.1, even with just two, they make a little bit more than your normal dogs, which is why they're a little more wrinkled even if they have two. But then what happened is that one of these mutated into a CNV5 allele, meaning there are 5 copies of this one here that are inherited together, okay, in bulk. So they inherit either 1 or 5, okay, which means that almost all the dogs, and we'll talk about this at length under the genetics portion, are either a 2, a 6, or a 10, because they've got 1 from each parent, or 1 and a 5, or 2 5s from their parents. So remember 2, 6, 10. Those numbers are going to be really important to you going out. The Has2 enzyme here is on the inside of the cell membrane, and the little factory combines glucuronic acid with N-acetylglucosamine, and then it's actively pumped out of the cell, okay? And it's considered an extracellular substance. But it's pumped out through a transporter that requires magnesium, which is important because I've seen over and over a lot of Shar-Pei that are hypomagnesemic. And that's one reason I put it in my supplement, and if the dogs don't take it, I still recommend you look at supplementing with magnesium. And frankly, 67% of humans are also deficient in magnesium, so it's not a bad idea to think about taking it yourself. It's really important in energy metabolism, among a gazillion other things. But what they discovered was they can't make hyaluronan in a petri dish unless they add magnesium. This stuff is that important. It just doesn't happen without magnesium, okay? Magnesium also helps stabilize hyaluronan in the networks we're going to talk about a little bit. It stays in its big, long form, which is the healthy form, when there's a sufficient magnesium present. That's one thing that will contribute to it. I find interesting here, this transporter here, this is the CFTR transporter here, is the one that causes, when it's mutated, it causes cystic fibrosis. And there's a scientist who really believes the problem with cystic fibrosis is that they are not transporting hyaluronan outside the cells. They explode inside the cells, kicking out the hyaluronan, and these patients end up with so much hyaluronan in their airways that it's causing a problem. Okay, so why is hyaluronan so bad? If this wonderful substance that's everywhere, why is it so bad for our dogs? It's not bad in intrinsically, okay? When it's made in its native high molecular weight form, if it has all the substrate it needs in a best possible world, the cell makes it in a very, very long chain. It's probably the longest molecule in the body. The stuff is huge, okay? And what you do is that its function depends on its molecular weight. Little tiny pieces, HA oligosaccharides, will actually activate the inflammasome, and the medium-sized, low molecular weight pieces will the small pieces prime it, and the medium, low ones will actually activate the inflammasome. And I'll go a little bit more into that. But it's a signaling molecule as well as a sculptural material. Hyaluronan is also the molecule that the body uses to kind of create things. It's the body's clay in some instances. It forms a lining around eggs. It's involved in reproduction. It lines the fallopian tubes. It's kind of everywhere. But that's all in its high molecular weight state. It's when it gets fragmented that it becomes a signal molecule. What we have is what's called an inflammasomopathy. And you guys don't need to remember it except to get the kind of the concept across. This is why the human side was so interested in Shar-Pei as an animal model, because inflammasomopathies right now are one of the cutting-edge diseases. They're really investigating them on the human side. And the NIH actually invested hundreds of thousands of dollars into our research. Okay, not me personally. But a lot of this was funded by the NIH because we have an animal model for a lot of autoinflammatory disorders. And it's things that go wrong with the inflammasome that cause the problem. And the inflammasome is a protein platform inside monocytes, macrophages, and mast cells, okay? And you'll often see or I'll often see on blood work, you'll see an elevated monocyte count on a Shar-Pei that's apparently healthy or in one that's recovering from disease. And some of that, I think, is because, you know, even though the disease doesn't look that bad, they often get bumped up because of this process. This is from the first paper that came out in around 2009 where I had a eureka moment. What they showed in that paper was hyaluronan by two different pathways goes down and is broken down and forms the oligosaccharides that activate the inflammasome, prime the inflammasome, and then by another pathway it goes down and it ends up forming IL-1 beta, pro-IL-1 beta, and then it's cleaved in this process. But one of the things I found really fascinating, and we have reproduced with experiments on Shar-Pei, is that they have elevated chemical messengers, including IL-8, which attracts neutrophils. This is a problem for those of us veterinarians seeing Shar-Pei around the time of a fever event, because typically veterinarians will run a CBC and they say if there's neutrophilia, well, it must be infection. The problem is that a Shar-Pei fever will elevate the neutrophils here. So you can't tell by a CBC if you have active infection or not. It is expected to find neutrophils. Usually, if the total white count is elevated, it's elevated due to a neutrophilia or an elevated neutrophil count. I will sometimes see an elevated monocytosis along with it. And in really, really severe, very bad fever events, often those that result in vasculitis, we will see a profound neutropenia, meaning the neutrophils just disappear. And that's because they're sequestered, they're taken outside the bloodstream, and they're actively involved outside the bloodstream, and they're not being able to be measured in the bloodstream. So what I want you to think about, among all the things it does, is that the most important for us, as far as the Shar-Pei autoinflammatory disease goes, is that hyaluronan is a barrier molecule. That's what's protecting your dog, okay? And if that molecule gets broken or fragmented or attacked by bacteria or yeast or various different substances, it sends off these little pieces which enter that inflammatory pathway I was just showing you that activate the inflammasome, and that can trigger fever and inflammation. So if this stuff gets broken, you may indeed have a problem. And I'll talk a little bit about, I think it may not necessarily be any single thing. I think it also can be cumulative. So the way to remember is that your Shar-Pei are vulnerable. And one of your jobs as a Shar-Pei owner is to help them manage the environmental insults they may be exposed to. So let's talk a little bit about all the things that could trigger fragmentation of hyaluronan. And these are just some. Hyaluronan is really dynamic. It's constantly being turned over, degraded, metabolized all the time. So in some places, it only lasts a couple of hours. Other places, a couple of days, at most a few weeks. So the body is always taking its own enzyme system and breaking this stuff down into little pieces and then reforming it all over again. So there's always a background level of fragments that the body just knows is there. It's part of its homeostasis, its normal background, what it knows is okay. But if you think about a Shar-Pei, particularly a really heavily wrinkled Shar-Pei, and it's got to turn that normal amount of hyaluronan over for that individual, it could be exceeding what its little sensors inside think is a normal amount of fragments. And we hypothesize that some of these dogs are actually having random fever events simply because of the normal turnover of their excess hyaluronan. So you may not be able to identify a single trigger. And I also think this may be one component of why some dogs are a little bit more sensitive than others. Their threshold of fragments is a little bit higher than a lot of other dogs. And then trauma, cold, heat, shock, all of these things have been shown to fragment hyaluronan. Reactive oxidative species. There's a lot of things that can do that, including rancidity, but it's also a process of infection and other things as well. But it's one reason why I do believe that these dogs do a lot better when they have an adequate supply of antioxidants on board to help counteract anything like that could be increase the amount of reactive oxidative species that they're exposed to. But this, to me, is really the biggie, and it includes if hyaluronan is a barrier molecule, I want you to think about it. It's the barrier molecule in the skin, lining the gut, kind of all over the place. But the skin and the gut are the two places I think most Shar-Pei, if they're going to have trouble, that's where you're going to see it. And because those are the areas exposed to the environment. If they get a hyaluronidase, and a hyaluronidase is an enzyme that chops that hyaluronan up into smaller pieces. If they get a bacteria or a yeast that chop that hyaluronan up, and particularly yeast love to chop the hyaluronan up, and they use it as a carbon food source. That's why yeast infections in Shar-Pei can really be a wicked thing, because they not only break it down into little pieces, which are pro-inflammatory, but then they feed on it, and it just keeps getting worse and worse. Biting insects secrete a venom that has hyaluronidase. Many of you have seen your Shar-Pei overreact with what looks like an allergic reaction to a mosquito bite or a bee sting or these kinds of things. And in a lot of ways, it is an allergic reaction. It's just that's how a Shar-Pei is going to react to something that squirts something under its skin that makes its hyaluronan melt. So this is why I think it's incredibly important for you to keep the dog's skin clean. It's not because they have wrinkles and this kind of thing. It's because you want to keep the pathogenic bacteria that might be cleaving that hyaluronan down as much as possible. Just keeping them clean. And I'm not talking sterilizing the dogs. You don't want that, okay? And that's why usually, I normally, for my dogs that are relatively healthy, will recommend something like Zymox. You don't want to necessarily sterilize the dog with a really potent antiseptic shampoo unless you've got a really wicked antibiotic necessary, disease going on. I like the Zymox for just maintenance. There's a lot of times it's insufficient when these dogs get really, really bad infections. But I've seen a huge difference in my own patient population with regular and routine cleansing. Is that the only one? No. There's other things that will work. It's just the one I'm finding that's working the best for background maintenance. Now, the other thing I like to see, the looks on people's faces when I say, I'd like you to bathe your dog twice a week. Particularly the pet owners. Most of your show dogs are somewhat accustomed to being groomed, but the pet owners, there's a little bit of a freak out. I actually had a Shar-Pei client once who told me, well, actually she presented the dog to me because she wanted to give the dog a bath, and it jumped through the screen on a second-story window rather than get a bath, and she swore the dog would rather commit suicide than get bathed. And the dog landed on the garage roof and got some bruises and was fine. But for those dogs, what I'm finding works just as well for routine maintenance is to take a basin of warm water, squirt a little bit of Zymox in, take a microfiber dust cloth or a washcloth, and wipe the dog down. And do that a couple of times a week, paying careful attention to those areas, you know where they are, under the neck folds, you know, kind of around the mouth a little bit, that kind of thing, and the hock wrinkles. But just dust the dog. You know, just wipe all that stuff off. That will make a big difference. Yes? The regular Zymox shampoo and rinse I'm talking about. Okay. Not the no, the shampoo I don't think has hydrocortisone in it. Yeah, the yellow label. Okay. Physiologic stress can sometimes result in an autoinflammatory event, which many of you know. I've known for decades, people would come in and tell me that every Monday their Shar-Pei would get a Shar-Pei fever event because the grandkids were there on Sunday. If the grandkids didn't come, the dog wouldn't get a fever event. And it's usually the next day, usually. Not always, but usually. And I've had people tell me, you know, that they will get a Shar-Pei fever event after they go to the veterinarian. That's another stress that will do it, whether or not they're vaccinated. Okay, I do think that potentially a vaccination could be enough of a stress to trigger it, but I've seen it even if all they did was walk into the exam room. Okay, and this is because when you get that kind of physiologic stress, your brain sends signals to your gut. There's a huge amount of nerves in there. There's that brain-gut connection. And it disrupts the normal bacterial flora, and various different changes happen in the intestines, and it causes inflammation. I mean, you know that whole thing about stress makes your gut clench, and you know the same thing's happening to our dogs. And you'll see the classic, and many of you are very familiar with this, the dog, a strange dog who's boarded or kenneled somewhere, is not used to being left, will often break with severe stress colitis or diarrhea, these kinds of things. And this is part of that. You're having an autoinflammatory response as a result of physiologic, psychiatric changes. You know, that brain-gut connection. It happens often enough. There are certain Shar-Pei patients of mine, I simply put them on metronidazole, which is Flagyl, before they're boarded or kenneled, because I know they're going to get a gut overgrowth, they're going to break with diarrhea, and they do much better when that happens. So, Shar-Pei autoinflammatory disease. And the official description is these things: Shar-Pei fever, amyloidosis, otitis, hock or other swelling and inflammation, and the mucin bubbles, vesicular hereditary hyaluronisis. There were some other things that didn't quite make statistical association that I truly think, like the diarrhea, are related. But diarrhea is such a catch-all term, it's hard to put it in. And that's why I don't think, I've just seen it so consistently. My feeling, my own personal opinion, is that chronic diarrhea, chronic intermittent diarrhea or chronic diarrhea is part of this, just like chronic skin problems can be. And about half the dogs, only half the dogs with a Shar-Pei fever event will have the associated hock swelling. Some of them have muzzle swelling, and it can often be mistaken for, or it's hard to tell the difference between muzzle swelling and an insect bite sometimes. It can, and I do think it's got to do with the kind of connective tissue that's in these areas. I think the periodontal tissues and the areas back here in the tarsus are some of the things we see. Wear matters. I had a long talk with a human rheumatologist because he felt that the human side, they were ignoring the wear. Why do you get gout in your big toe? Why do you get gout, you know, why do you get humans with familial Mediterranean fever, which is the human equivalent of Shar-Pei fever? They get swelling in their knees and ankles. And so why those locations? And he and I were talking about that, and we were sharing some possible explanations for that. But this is typically where you'll see it. I've ever seen it in a front leg, in the carpus. It can occur there. And then it gets a little bit difficult. Are you dealing with a regular dog joint infection that happens to be in a Shar-Pei, or are you dealing with a Shar-Pei fever episode? The thing I try to tell people is remember that your dogs get every single thing that non-Shar-Pei get, okay? And every little thing they get like that, which they can get, not everything is Shar-Pei fever, but remember that because of the role of the hyaluronan, they're going to overreact to that. They're going to get it worse. They may get it longer. They may have other complications that they wouldn't have had. And those are the things to keep in mind. That, yeah, it might be this infection, and there probably is an infection, in that individual's case that needs to be appropriately addressed. But you've also got layered on its Shar-Pei-ness, and don't forget that, okay? Because the veterinarians are beginning to come around that, yeah, they are different. They are very different. This is Ellie. She's getting her weekly IV therapy or as needed for her amyloidosis. Unfortunately, most dogs don't have this kind of a wonderful outcome where they're getting a pedicure from the LVT while they're getting their IV fluid line. I just love this picture. This dog actually lived for a little over 2 years with her end-stage kidney disease, and the owners were really dedicated to keeping her going. And they had a cooperative patient. There are some Shar-Pei that just wouldn't put up with this. I mean, you've known them. And she was one that did very well. She had a dedicated owner and a cooperative dog and a veterinarian who was willing to go to the wall for them. And as far as the amyloidosis goes, one thing I want to throw out there, I don't have time to go into a lot of this today. I could easily do 6 to 8 hours on Shar-Pei health issues. But I want you to remember that Shar-Pei do not get kidney disease the way non-Shar-Pei do. If they have elevated kidney values, they will often be 4 or 5 times higher than a non-Shar-Pei and still be not doing so bad. A lot of veterinarians will see the numbers and immediately recommend euthanasia. And they're right if it wasn't a Shar-Pei. Okay? I have seen dogs. I got really disturbed by an article in the Journal of Veterinary Internal Medicine because most of the dogs with the numbers they put up there were euthanized within 2 days. And it just made me ill because I knew a lot of those dogs could have been stabilized and lived months or even years like this one if they had been brought down. For those of you that know the numbers kind of situations, I had one Shar-Pei one time come in with a BUN of over 300 and a creatinine of 25.5, and that dog lived another 6 months. Okay, so my rule of thumb is I don't give up on a Shar-Pei until the Shar-Pei gives up. Okay, and assuming that also takes into consider the financial aspects. I mean, that's the reality of the situation is sometimes this can get really expensive. And I also get, there's the emotional thing. After you've done this once or twice, you know where it's going. And it's sometimes really hard to keep doing it. I find people as they go along will usually choose euthanasia sooner. All of us, usually do that. Others, they get so set up as practically a system. I know one client I've been working with, his whole life revolves around the sub-Q fluids morning and night to his Shar-Pei. Everything's set up around that. He's got caretakers who come in when he has to go on business trips, et cetera. And that dog, was doing really well for a long time. He actually passed away a little while ago, but I think he got about 16 months more time. And his veterinarian had told him to euthanize the dog. But it's a combination of these dogs can, with support, do fairly well. Not all, but most. I mean, there are still some that die within a couple of weeks no matter what we do, because really apparent because the numbers keep going up. The other thing I'll tell you is right now, I don't even normally check the numbers except maybe to tweak the electrolytes or something for at least a week, because I'll find that sometimes the numbers still continue to go up before they start to drop down, and that just makes us all crazy when they go up, okay? I go by how the dog is doing clinically. I've got one in the hospital right now that came in, the BUN of 185 and a creatinine of 15 something. We started IV fluid therapy, which I don't necessarily do unless the levels are super high. Got that dog rehydrated and flushed through a little bit. That dog's numbers have only dropped a little bit, but he's eating and he's playing, he's pulling on the leash, and he wants to go home. So he's going home on sub-Q fluids. Okay, so you have to treat the dog, not the lab work. okay? And this means getting a dialogue going with your veterinarian and hopefully being able to work with people who respect your opinion and will seek out other advice and that. Because if they go by what's in the literature, I can't blame them. That's what's in the literature. They're going to die within 2 days. And as we were discussing before all this started, I need to spend some time writing up my journal articles and getting this into the veterinary, arena so that I'm not the only one that knows this stuff, okay? And that means that I'm going to probably pull back at some point from the individual requests because I get so caught up in the urgent, currently dying Shar-Pei that I don't get time to deal with the bigger picture stuff, which is educating the veterinary community. So going down the list, ears. Most of you who've known me a long time know that ears are one of my pet peeves, okay? I think that the ear standard should be changed, that they have a tall, big, erect ear with a great big ear canal. But I've been voted down repeatedly. I would at least ask you, and I'm being dead serious here, the stenotic ears with chronic ear infections are as much a sign of Shar-Pei autoinflammatory disease as Shar-Pei fever. So when you're looking at your dog, trying to figure out what's going on here, put that big black check mark next to the dog with the tight, gross ears, okay? It's not a strike you're out kind of a thing, but it's a, come on, you gotta realize this is a problem, okay? And I'll say, not just for what it represents in that it is an aspect of Shar-Pei autoinflammatory disease, but this is a huge problem for the pet owners. These dogs suffer. I see dogs that are terribly aggressive. They're suffering in pain. The owners just can't get a handle on it. I finally do when they come in for referral, but I know a lot of times these dogs just live in pain all their lives. And it's because you've got a combination of a tiny, tight, wrinkled ear canal. It's this tortuous thing that goes down there. They tend to produce excess oils and wax, which are great food for the yeast and bacteria. And then the yeast and bacteria come in and feed off the hyaluronan, plus they're prone to allergies, which cause swelling. It's just a formula for disaster, which you all know. In my opinion, it's this tiny, tight, stenotic ear canal, not the ear flap. And the problem we have is the standard. The intention is really that the ear flat be a little triangle. It doesn't say in the standard, have a tiny, tight ear canal that you can't get a Q-tip down, okay? So you can have your little ear flap, but try to find an ear canal in these dogs, okay? So as far as, somebody asked me ahead of time what I recommend with these. Again, for maintenance, most of my patients, I'm looking at Zymox products for this a lot of times. The Zymox product for maintenance, what you'll read on the bottle, it's an enzyme product that digests the wax and debris that's in there, and that's a really good thing, okay? But what you want to remember is that you've got a tiny, tight ear canal. They're not non-Shar-Pei. They don't have a great big ear canal that you can pour this stuff in and have it soup around and then come back up. So what I tell you, and be very careful how you do this, okay? Put the stuff in, massage the ear canal going down to the brain, okay? Just keep massaging. Let them go outside, slosh their head around, shake their head till they're crazy, bring them back in, wipe it out with a paper towel or cotton balls, etc., and then take a Q-tip. I know this is against all the rules of veterinary medicine, but take a Q-tip and scoop the stuff off the top. Scoop the stuff off the folds. Never plunge that thing down. Okay, you're going to take a scooping action because you want to open that hole at the top so that you can get the Zymox down where it needs to go. Okay, I think that when I initially started using Zymox, I didn't think it worked. And I think that's because everybody was just squirting it in. It was just going right off the top and off the dog. It wasn't getting down into the ear canals. Now that I'm having people kind of scoop this stuff off the top, more will come up, you scoop it off. More will come up, you scoop it off, and eventually it kind of comes out. Or you can have a deep cleaning done at your veterinary hospital, okay? And start afresh, okay? And that's, if I've got a chronic ear infection, I'm doing a lot more than that. I'm doing cultures, I'm doing cytology, I'm looking at allergies, because as I said, it's not any one thing. There's not a silver bullet that's going to do. But as far as maintenance goes, I like that routine for trying to just keep them clean in the first place. Okay? And then bubbles. Unfortunately, most of us know what these look like. And this is vesicular cutaneous hyaluronisis. No one gets out without saying that 3 times fast. And what it is that the little factories are making so much of this hyaluronan, it's accumulating in the skin in bubbles and lakes. And you're seeing it bubble up. These are bubbles of hyaluronan. And this is a dog that you'll often see them on the forechest. You'll sometimes see them right above the anus. Other dogs have them in the flank area. Some of them just seem to pop up all over. I can still remember we hired a new veterinary technician, and I forgot to tell her about this stuff. And she went back to clip up a dog that was going to be spayed, and she comes back up with this clipper with this goo coming out. Oh my God! No, it's normal. Just next time, just go over the surface. Don't. It's very fragile stuff. But it's not just the bubbles. You can see sometimes you'll see in the whorls, you'll see these patterns where the mucin has kind of bubbled up and separated the fur away. So you can see that there as well often. And it's fragile. You know, when I'm starting to see spontaneous tears, that's when I think about treating this. Okay. If these are spontaneously rupturing or these are spontaneously tearing. I had one patient that I used to see a lot where she'd come in with just scars all up and down her front legs from just running into stuff. You know, typically they'll come in often, they tore it coming out of the car. It just two Shar-Pei playing with each other will end up with these dangling wounds sometimes. And I'm sure all of you have seen something like that at some point. You know, and fortunately, that goo is what the body uses for wound healing, and you just kind of stick it back together again, and if it's clean, a lot of times it'll just close itself. But these are the bubbles on a front leg. And again, a complicated slide, but it brings up an important point. These are the this represents the inside of a lymphatic, or you know, the little pipes that lead to your lymph nodes. And hyaluronan, when we're talking about it's constantly being broken down and moved, some of it is recycled locally, but a lot of it goes into your lymphatics and is carried back to the liver where it's metabolized. So there's always a ton of hyaluronan traveling constantly through the lymphatic system. And there's receptors there that bind to low molecular weight hyaluronan. So if you have a huge amount of hyaluronan damage and it goes into here, I think what happens sometimes is it binds to here and you get a pro-inflammatory, the lymphatics themselves get inflamed. And then they can get scarred down and obstructed. And then you start to see fluid accumulation in the lower legs. Kind of like that. Okay, now this is dramatic. Okay, granted, this is probably one of the worst. I've seen another one just as bad. You know, this can get really bad. This is actually filled with lymphatic fluid and hyaluronan. Okay, there are more. Yeah, I mean, this one catches your eye, but it's all up and down her legs. Okay, she has lymphangiomatosis. These are big blebs, cystic blebs of lymphatic fluid and hyaluronan that have accumulated. And this dog, it was just pooling, spontaneously weeping under the table. Okay. When I drew this sample, I had already wiped it up, and this is not from the area I had aspirated, but there was a huge pool of fluid on the table. I mean, just puddle, because it's under pressure, and it just dripped out onto the table. And it's clear, and if you look at it under the microscope, it's lymphatic fluid and hyaluronan. More typically, this is what I see. This is one of my patients that has, these are little nodules of cysts of hyaluronan. I could tap in there and get a couple of milliliters of lymphatic fluid and hyaluronan. And there's little cysts within this, and if I tap this, I'll get a lot of mucin. This area, this dog has had resected repeatedly for small mast cell tumors as well. Which brings me to, okay, there's a reason our dogs have mast cell cancer in greater incidence than most, in my opinion. And that's, this is something that anytime you see a lump on a Shar-Pei, it should be aspirated. Anything bigger than a pea, get it aspirated. It can look like anything. This dog was presented to me for over a year. They were treating her skin infection back here, and I stuck a needle in it, and it was a grade 1 low-grade mast cell tumor. She lived for years after this with appropriate care, but it was getting really bad. It had covered the whole back leg, and we got it down to a small area right here with treatment. But if you have something where it's just not doing what it's supposed to do, get your veterinarian to stick a needle in it and get cytology. Okay, mast cell cancer is so common, and it is so scary. There are some that are very benign, like this dog, okay? And you know, even though it was extremely locally extensive, didn't take her life. She died of something else. This dog, however, had been treated, this came in for a second opinion, and it was being treated for a skin infection. And the reason I believe this is happening is because hyaluronan with its receptor CD44, that actually directs the maturation of mast cells in connective tissue. So these little pieces of hyaluronan tell the body to lay down more mast cells in the tissue, which is why when I aspirate an area of mucinosis, I will usually get some mast cells. That's expected. That's normal. What I don't want to see is them in sheets and clusters. If it's in sheets and clusters, then I'm going to want to excise it and get a good biopsy. But if I'm just finding them kind of scattered through, that's what I would expect, because the hyaluronan chains will bind mast cells to them, and they will direct the body to fix them in the connective tissue near the skin there. But you notice how, you know, these are the fibroblasts. These are the primary cells that make hyaluronan. You know, we were talking about on the inner surface there. There's your little factory there, and then it kicks it out. It kicks these long chains out in filaments off the fibroblasts. And in reality, this is actually from a Shar-Pei. These are the fibroblasts, and these are the long chains of hyaluronan being kicked off in these little blebs here too. These are actually other cells, but these cables with these blebs on it. That's all hyaluronan coming out of a Shar-Pei. Okay, I want to talk about this because I've had 2 horrendous cases in the last week. This is a dog I saw last week. This dog, you can see, there's pus, it's seeping, you see the bruising all through here. The skin this is all going to die and fall off. You can see the yellow pustules up here. You see a Shar-Pei who starts with a high fever, and then within a few hours or the next day, starts forming pustules and bruises. You get your dog to the ER. This is a life-threatening emergency. Many of these dogs can be saved with early intervention. Sometimes it's fatal no matter what we do. And the reason is because the lining of the blood vessels, the endothelial glycocalyx, all these little filaments are mostly hyaluronan. If they get a bacteria into their bloodstream that's breaking their hyaluronan down, the lining of their blood vessels breaks down, and then what happens is that this is the lining they were just showing, okay? These are the blood vessel cells, the endothelial cells. They normally have these little buttons between them. If the hyaluronan gets fragmented inside the blood vessel, fragmented here, what happens is the skeleton that's inside the cell that holds it in place contracts, and it sort of collapses on itself, and it separates, and fluid and red cells and other proteins will escape outside the blood vessels. And some of the proteins that are supposed to be in the blood vessel, when they're sensed outside the blood vessel, that's a huge alarm system to the body, and all kinds of inflammation is set off. And you get what's called a neutrophilic vasculitis, because the neutrophils go pouring in outside the blood vessels, fluid leaks out, you have a severe case of sepsis going on in most of these dogs. And I'm showing you this. It's, you know, I usually see a number of cases a year and hear about more. It is rare, it is uncommon, but I want you to know what your worst case scenarios are so you recognize it. I think that leakiness is also why some of the Shar-Pei have chronically swollen legs, that those cells pull apart due to the fragmentation, and they get chronically leaky legs. In swollen hocks. So we're going to talk about the test. And I'm going to encourage some dialogue about this too, because I think it's something we all are going to need to be talking about. No decisions will necessarily be made today. I'm going to tell you my own thoughts on the matter, but a lot of you have a lot of experience and a lot of knowledge in the breed, and these are things that as breeders you're going to have to make certain decisions about. and the club as a whole is going to have to make some decisions. So, as I said, this is the start of a discussion. The Shar-Pei autoinflammatory disease, or SPAID test, is for the disorder I was just talking about. Those 4 things were all linked to it. A less strong association with amyloidosis, but all of us, the geneticists and I, are in agreement that one of the reasons we had a less tenuous association with amyloidosis in our study is because we made our criteria for entry into that group so strict. Because we wanted to make sure that the negatives were true negatives and the positives were true positives, and we had a much smaller set than we did in the overall group. Okay, I think we had 327 dogs in the overall group, and like 30, amyloid cases. So it was a much smaller group. So, do I think that amyloidosis is only caused by this? Absolutely not, and the geneticists don't either. We're moving forward on the hypothesis. They're actively already undergoing the research. They've got a cohort of 50 some odd dogs right now they're looking at with amyloidosis. We think there may be other genes that when you layer it on top of SPAID, they act as accelerants. And that's why some of these dogs die very young. I had a case about 2 years ago that just broke my heart. One of the nicest little blue brush coats I've ever seen. What a sweetheart. Just one of the nicest dogs. I absolutely adored her. Sweet-natured beastie, real cuddly. And at 9 months of age, she went into kidney failure. She was dead at 12 months of age, and every organ in her body was completely effaced by amyloid. Okay? That's got to be an accelerant. Okay? That's not just SPAID. Okay, I'm really comfortable that there's other factors that we layer on top of this. But again, we're layering it on top of a dog that overreacts to stuff. Amyloidosis is a disease that often happens in older dogs with lifelong chronic infections or inflammation. You'll see it in sheep with a nodular granulomatous disease that causes chronic pneumonia will sometimes die of amyloidosis. We don't see amyloidosis normally in young dogs, and that tells you that there's something going wrong chemically in the dog's body. So my research colleague in Sweden, Jennifer Meadows, is really concentrating. Her next area of focus is what's causing this smaller cohort of dogs to die so young of amyloid. Okay, so there is ongoing research into that area. But I still want you to think of amyloidosis as part of this. It is part of this, but granted, yes, there's more to it. All right, so here we've got parent 1 is a 10, and parent 2 is a 10. They're all going to be 10s. Big surprise. And this mating, we're going to breed a 2 to a 6. And again, you're going to see 25% are going to be 2s, 75% are going to be 6s. Oh, I'm sorry. Yeah, 50-50, sorry. Thank you. Okay, so here we're going to breed a 2 to a 10. And you can see we're all 6s. And here we breed a 6 to a 10. And you've got half 10s and half 6s. Okay, so this was an actual test breeding that the geneticists did in Sweden. And you'll see a couple of generations here. They bred a 6 to a 6. And then they measured the offspring. And they got a 6, they got a 2, they got a 6, they got a 10, they got a 6, they got a 6. And then they bred this 6 to another 6. They got 2 2s. Well, because they've got a 1 and 1. Right. Okay. So you can't, even though he's saying 25, 75%, 50%, life doesn't work like that. Right. So you're not going to know without testing. Okay, this is actually right off Sweden's report, and Cornell says they're going to do something similar. You're going to see, you're going to get a number back. This is the explanation page, but you're going to be given a number and non-carrier, single carrier, double carrier, because the only one that matters is that CNV5 allele. This is the thing that we need to talk about. The 6 is 4 times more likely to have SPAID than your average dog. Okay? The 10 is 8 times more likely. Okay, that's why those 10s are so vulnerable, and you don't know who they are by looking at them. You really don't. I couldn't tell. I was shocked. There were a couple of dogs I thought were traditionals. They were 10s. You can't tell by looking at them. And that's why everybody's been blindsided over and over again. Okay, so again, this is the description that's going to be on the reports. This is what was decided on by the group in Sweden, and I agreed with it. So if, say, one of your puppy people goes into the vet, they run a SPAID test, they're going to get this back with this on the bottom. Again, we'll start some discussion. How to use the SPAID test. The obvious thing is for breeders, because I don't think there's going to be a whole lot of discussion. I think most breeders are going to want to know at least what the parents are. Okay? Question then, and this is a discussion everybody should have, is those puppies. Do you test all of them? Do you just test the pick puppies? I've been leaning more and more. I was thinking that I wasn't going to be testing many pet puppies. I'm now thinking I may be doing more testing of the pet population than I thought. Because for one thing, it's going to help me decide whether I want to start these dogs on colchicine, which we didn't get into at all today. But if I've got a 10 that's had 1 fever, I'm going to be much more likely to start colchicine than if I knew that dog was a 2 or a 6. The reason thing I see where I need to go out on the circuit to talking to veterinarians is that this is not really a diagnostic test for Shar-Pei fever, in the sense of dog spikes a fever, the veterinarian's going to say, well, let's run a SPAID test. Well, that's not really, because as you know, they're not one and the same thing necessarily. And only 5% of the dogs tested in Sweden were 2s. Only 16 out of 327. And I've thought a lot about this because this is a disturbing number. But you guys, most of the people who were kind enough, generous enough, and in the game enough to send samples were sending their breeding stock, their show dogs, they weren't sending the pet dogs. I'm speculating that you're pushing the 2s out of the pool. I think there's a lot more 2s. Because you saw that where they did the test breeding, they ended up with 2 2s. I'm betting those were ugly little puppies that the breeder would not have kept. So again, these are discussions you have. Are you pushing the 2s out of the pool? Okay, because right now, we need a lot of genetic diversity. We need to encourage the 2s without selecting just the 2s. Okay. As far as my opinion and guidelines, okay, this is what I would recommend. This is not the word coming down with the tablets, okay? This is for discussion, my opinion. I think, and the geneticists agree with me, you should not be removing your 10s from the pool. But you should never, ever, ever be breeding a 10 to a 10. There is no reason to breed a 10 to a 10, okay? Breed your 10s, and you're going to find out some of your bestest, most favorite dogs are 10s. Breed that dog to a 6 or a 10. And for most of us, that's going to mean breeding a 6 or a 2. 6 or a 2. A 6 or a 2. 6 or a 2. Okay. And then one of the things that almost all breeders agree with, you should be improving as you go along. Your next generation should be better than the one. That's why we have, the stud dog get up there with his offspring, this kind of thing. You should be picking a dog that's as good as, or at least as good as the one you got out, okay? I think that if you do this, you can pick a 6 that's as good as the 10 and throw the 10 out of the pool after you've got sufficient numbers of 6s. And then you start breeding the 6s to the 6s and working your way down, okay? But the problem is, this may turn out that all you're selling is your 10s, okay? That's not going to go over real well with the pet people. And what do you tell them? Now, the CNV6s were 4 times more likely to show signs of SPAIDs. The 10s were 8 times as likely, but 75% of whether or not they had a fever or amyloidosis or ear infection was environmental. Even if you have a 10, it can live to be 14. Genetics are not destiny. It's the interaction of the environment in which genes get turned on and this sort of thing. If you don't have the triggers that are upregulating the hyaluronan, and the dog is lucky, because frankly, some of this is not preventable. We cannot control everything. I don't understand why, but we can't. But this is why really good management of these dogs is so important. It's the most critical thing you can do is just trying to keep them clean, safe, well-fed, nourished, and provide them with the stuff they need to make good hyaluronan, okay? You can control those factors. And if you have that discussion with your puppy people, I was thinking this morning, I kind of compare it to the talks I have with a young person who comes in and wants to be a veterinarian. I scare them half to death. I tell them every bad story I could possibly tell them. I tell them about the poor pay, the long hours, the lack of appreciation, which isn't from you guys. You know, and if they still look at me and say, but I really, really want to be a veterinarian, then I give them information on what they got to do, okay? I think you really should be scaring the potential puppy owners, you know, of all kinds of potential problems. If they still want a puppy, I want a wrinkled puppy. Okay. This is what you got to do, though, okay? And this is why, you can hear, I've heard from breeders, I've got this long line. Every dog in my cat never had a fever. I sell these dogs, they have a fever. You know, this is why, because you've got really good management. You know what works. You keep your dogs in a controlled environment. You raise them a certain way. You feed them a certain way. And then you throw them out into these people who don't do what you do. So I would really recommend that you think about what you do and make up guidelines, you know, for what you're doing that's working for your pet population, you know, for your population, because it may vary between, because you may have a slightly different genetics than, say, the breeder over here, okay? But what's working for you, okay? And while I'm thinking of it, teething does not cause Shar-Pei fever, okay? Does not, doesn't happen, okay? Granted, there may be stresses or things that might trigger it, but teething itself never, ever causes a fever in a non-Shar-Pei, okay? So just put that to bed. It never causes it in a non-Shar-Pei will have a fever, okay? You just don't see it. Not 104.7 fever. It just doesn't happen.
Not in humans don't fever with teething.
No, in fact, teething babies may get cranky and irritable, but they don't spike a high fever. Right. Okay. It just doesn't happen. It just doesn't happen. You've got a fever, it's something else. Now, there may be stressors going on that cause that individual Shar-Pei, but start thinking, oh yeah, he had a Shar-Pei fever episode, because we can't just keep sticking our heads in the sand like ostriches. The only way we're going to move away from this is to acknowledge a problem, make a plan of action, and move forward. And I think right now we finally have a tool where we can start doing this. You guys are really dedicated. The fact that you're still here is kind of amazing. I mean, I used to say Shar-Pei owners had this great big wide masochistic streak running up and down their back, because these dogs will break your heart over and over again, okay? I think they're one of the most wonderful dogs that ever walked the earth, but they will break your heart. And we keep going out and getting another one. You know, and it's a testament to how special these dogs are that we keep doing that. So we owe it to them to try to make them as healthy as possible. Because you're not going to stop breeding Shar-Pei. If you individually decide you can't stand it anymore, okay, I can kind of understand that, but there's somebody else who's going to keep breeding Shar-Pei. And I would much rather it be you guys who love these dogs, are dedicated to the breed, and are willing to make the hard choices to make this breed much more lived and healthier. And those are going to take some hard choices, and we're not going to do it overnight. We're suddenly not going to wake up tomorrow with just 2s and 6s in the pool. It will never happen, because as long as we're breeding 6s, we're going to end up with some 10s. Okay, what we need to do is make it, right now, as I said, a huge percentage of what we were testing were 6s and 10s. Let's make it so that it's, you know, a lot more towards the 2s and the 6s, okay? And that we recognize who these 10s are, and we can kind of send them out in a bubble. You know, be a little bit more careful with them and who you place them with. Again, Shar-Pei people tend to go back for more punishment, so you can explain to them, here's a 10 and it needs you. But I think if we're honest, I think you're still going to have homes for these dogs. You know, there'll be a lot of people who say, I don't care, I want this puppy. I mean, how many times have you, I mean, I can remember way back in the 80s when I was a breeder. if I had a puppy that I really loved, I put this outrageous price on it because I didn't want to sell it. And there'd be somebody who would meet that price just about every time, okay? If you tell them they can't have it, they're very likely to want it. But I think if we're just open and honest about what's going on and really deal with this head on, I think we can deal with this. And every single breeder is going to have their own mental discussions and talks with friends about how they're going to do that, because SPAID is not our only problem, okay? We don't want to reduce the gene pool so much that we're creating another problem, okay? We have a very small gene pool as it is. We want to make gradual and deliberate changes here. You need to be thinking about weighing, if the dog's got super bad orthopedic problems, but it's a 6, I'd still be throwing it out of the pool, okay? And every dog's going to be, every single dog is an individual and is going to have, you're going to be making these kind of deliberations about it. You're doing it now. This is just going to be one more piece of information. If you've got a dog with a couple of problems that are sort of troubling you, and then you throw in that it's a 10, whereas if you got a dog that, she's not really as much type as I like, but she's a 2, that may influence whether you're going to place that dog in a pet home. I went to bat for you guys because I promised you that if I could get you results, I would. And what the geneticist told me is that so much time has gone on and those samples have been moved around so many times, they do not feel that they could reliably report. Plus, a large percentage of those samples were used up. We've had so many iterations of trying to make this test, and we needed samples to create the test. They used up your dog's samples. And unfortunately, as she and I went back and forth, unfortunately some of the dogs deceased, they don't have samples. They're just not there. I can't, and she doesn't feel that if she can't accurately report with absolute certainty that this is your dog's result, which she's a little iffy on, and the fact that somebody else donated their sample and they can't get a result, okay? She felt that the best thing to do was not report any of the samples. And I am upset about it, but I can't do anything about it. Again, thank you to the Chinese Shar-Pei Charitable Trust. Your test would be considerably more expensive without their kind donation of the technology. The reason Sweden has the price the way it is because they had gotten the equipment for something else, and they're simply running the Shar-Pei tests on it. There's very few places that have this piece of equipment right now.